Some do, some don't. It
Depends on where.
It depends on where. And GSAs have to be implemented by students. The schools can't implement them themselves, just like any other club or organization.
It's more so on the college level. Being a sorority fraternity member, there was a group of GLBTQ that created their own fraternity that was a GSA.
Okay.
I don't know if their actual letters, their Greek letters, were Gamma Sigma Alpha, but yeah, I'd say it's more in the college community that these clubs or organizations or groups of people are getting together to raise awareness.
Okay. I saw a hand in the back.
Going back to what you said a few minutes ago, actually, how then, because you had said different districts have to create different policies or whatnot. Question one, what do you mean the expectations are different in different districts, and how would you address that? And then two, a lot of bullying does happen cross-district, especially in events that happen cross-district. Football games, different UIL events. So if bullying is happening at those events and different districts are taking part, how would you then address it?
Well, I think that Dr. Warren, and I agree with what he's saying. Yes, there are certain federal and state laws that will impact everybody, every district. But I think it's more the implementation that he's talking about is identifying those key people and identifying how it's going to work in your school. If you're in a rural area, and it's a much smaller school, and you don't have a school counselor on staff. Your school counselor travels between 3 counties, for example. You're going to have to identify somebody else who would be your point person within that school because there's not somebody there all the time, as an example.
Right. And so I'm not advocating that we address the overall bullying in different ways. I'm not advocating that we set different standards for different schools. I'm saying that the implementation and the way that we do it is going to have to be different in different places. Because that's one of the things about Texas, it's one of the things about the United States, is we all want to do things our own way. And that's why we move to different communities. And if we try and all do it the same way, we're going to have what we see at the federal level, where we get about halfway through the list of this is what you should do, and then it breaks down. Whereas if the individual schools, the individual districts create their own policy, then they're going to have a buy-in to making sure that it works.
And it's also going to go down to the individual level. I mean, that's what IEP stands for, right? So if you have a youth who is not gender normative, and depending on what the possible bathroom facilities are even available in the school, you're going to have to do an IEP that's going to be specific to their safety. And where do they have to be walked to the nurse's station every time they have to pee? That's not particularly useful. So, I mean, how would you manage that when there's no money to build a gender-neutral bathroom, for example, and that's where they're getting harassed? So there's always going to have to be that give and take of how do we adapt based on limited resources, limited funding, but people being safe. Does that answer your question? The laws aren't going to change. The response is going to be the same. It's how are we going to make it work? If I don't have a counselor on staff full time, but there is this person who's been the identified point person, if you always go see Coach Smith, this will be addressed. And everybody knows Coach Smith is who you go to, because Miss Rodriguez, our school counselor, is only here on Wednesday afternoons and Friday mornings. Those kinds of things. So you have an action plan in place.
It goes down to like creativity and brainstorming within the group of who you're
right.
working with, and like you said, rural versus suburban versus urban.
Mm-hmm.
Or it's going to work.
Yeah, or even different parts of town. Is there more funding in certain school districts where you could, adapt facilities? Yeah. Versus, we're overcrowded and we have trailers on top of trailers, behind the football field. I mean, you're going to have to do something different. Okay. Creating a safe environment for youth with disabilities or special health needs. Sometimes children with special health needs have a medical reaction. Has anyone had that experience where somebody who's allergic to peanuts was fed peanuts and messed with them? Yeah, I mean, that kind of stuff really does happen way more frequently than we realize. Making sure that we respond to that and responding to the bullying, really educating kids and teachers about special health needs. My daughter had, y'all, for those of you who are aware of the changes with the DSM-5, she would have had a diagnosis of social pragmatic communication disorder if it had existed. It took a lot of education with her peers to know that she doesn't have really good social boundaries and to know that she wasn't intentionally messing with people. And so even now where she's in school, they'll be like, Molly. And she knows that's her personal space. So educating peers about this is how you can interact with somebody who's different, and it really reduces the bullying when they can develop that empathy. I thought I saw a hand. No? So my advanced practice nurse has six kids just on her caseload that are being homeschooled because the bullying was so frequent and so severe their parents pulled them out of school. She came to me in tears one day and said, I don't have a pill for bullying. What do I do? So I wanted to talk a little bit about what we do in community mental health and how that can be integrated in all the places you work, whether it's an inpatient facility or a school. Okay. We just started less than a year ago actually assessing to ascertain if a child or youth is engaging in bullying behavior, and we also assess for a trauma history, which can be a result of bullying. So we actually ask, when we talk about trauma and they say that yes, there's been some kind of trauma response, we actually look if they were the victim of bullying within that. So I wanted to show you what that looks like. Is that very legible?
No.
So, no. Sorry. We ask the family, we ask the youth if they engage in bullying behavior, and we ask specifically, were they taking a leadership role in this? Did they get in with a group of friends that were bullying and they've gone along with this? And if they say yes, we treat it. So does your child get along with other children? Has anyone ever told you that your child has picked on, made fun of, harassed, or intimidated another child? Have you ever worried that your child might bully other children? We ask our families that now. We just started doing that. We're catching up. Okay, and we also do an adjustment to trauma, where we ask if there's a history or suspicion of, if there's clear evidence of an adjustment problem, or clear evidence of actual PTSD because of a trauma. Has your child or youth ever experienced a traumatic event? I'm reading it because it's a little blurry. This came from the state website. Tell me about that traumatic event. Do they have nightmares, flashbacks? How troubled are they by them? Are they unusually afraid of being alone or participating in normal activities? So part of that is if they say yes, we ask about the type of trauma. And we actually have one that really targets bullying. It's called victimization. They've been victimized in a significant degree, and they're at risk for re-victimization. For those of you who work inpatient, do y'all ask that as well in your intakes? No? No? This is the Child Adolescent Strengths and Needs Assessment tool that the state came out with last year. So then the problem becomes, how do you ask that question? A 14-year-old boy is probably not going to tell you they've been bullied. And there seems to be a language thing about it, and I've noticed when we ask it in a different way, we get different information. Sometimes you can say, has anyone bullied you? And they'll be like, oh my God, yes. Most of the time, no. Are there people being ugly to you? Do you get disrespected at school? You get a different answer, and then the stories start coming out. So how so? What's going on? Like, where? Is it school? Is it online? Is it other places? Do you feel safe? What do you need in order to feel safe? So what we provide is counseling and skills training, and all of these impact a wide range of needs, but we tailor specific to the issue. So if bullying is an issue and we don't have a pill for bullying, we actually provide skills training to the child and to the family, or counseling related to the topic. So we do cognitive behavioral therapy, we do trauma-focused cognitive behavioral therapy, which if they had a pretty significant bullying experience or other trauma, they get to tell that story as part of their work. They learn to manage it using CBT skills and techniques, but they also get to do what we call a trauma narrative and tell that story maybe for the first time. And we do play therapy with our itty bitties. You mentioned having a 4-year-old who was already struggling with bullying. We have like a toy box seated if we kind of know the story about what's going on so they can act out and tell that story. It's very healing to tell our stories. And we also do skills training, seeking safety, which is specific to PTSD for our youth who are also abusing substances because of their experience, where they learn how to take their power back, how to feel safe, how to be grounded. We do skills training in START. START is an aggression replacement techniques. This is very good for our children who bully. We teach them how to interact without being aggressive. We do case management. We provide case management for the whole family, and we do family partner services. And I think that this is, when this works well, is where we start making the connections to inpatient, to outpatient, and to the school system, is when we use peer support and family partners and case management services. A lot of times, you mentioned families aren't taking a huge role. A lot of times it's because they don't know, they feel pretty powerless in them themselves. So we have family partner advocates that go in and help them navigate the school system, help them have those conversations. And that tends to be very, very helpful. Patty Durr from the Texas Federation of Families will go in, and she no longer works for the Center for Healthcare Services, but she says, Faith, give everybody my number. I want to help everybody. She will actually help advocate, and she's helped more people with a 10-minute phone call, I swear, than I've done in 20 years in the field. So if you're having that kind of issue where a family really needs some advocacy, the Texas Federation of Families will assist in that regard. If they're not in services with us, where they are actually assigned a family partner, we do have resources available of people through the Federation that will provide support as well. Catholic Charities does a bullying prevention group, which is pretty cool. That's an option. I can show this video if we have time, but I want to make sure we have more time to facilitate discussion. I'm an LPC supervisor. One of my interns just got a job at Communities and Schools. She's a site coordinator now. And where she is, happens to have a pretty significant problem with bullying. She came in at the end of the year. They're kind of packing up and doing some summer work, and she's really spending her time right now preparing for the next year. The person that was there before her did some really cool stuff, like they were doing yoga and breath work and things. She's like, yeah, but the bullying, I want to do something with the bullying. So we're spending our summer actually creating a bullying prevention group that she can utilize with the children that she's working with in the school district. I love that she identified that, found that need, and is really spending time creating that in her little micro environment, rather than saying, okay, well, we already have yoga mats, so we're going to continue with yoga. So I love that about her. She's really neat. And so we kind of wanted to speak to that experience and how we can start making those connections and increasing that flow of communication with everybody here, kind of thinking about what y'all have said as being an issue. What I've noticed from this particular intern, who I love that she's taking the initiative to do something that's really big and beyond what she expected to do in this job. You want to speak to that?
So here's my proposal, and here's what I've seen has the potential to work. But I'm going to start off with some questions. Going back to our basic counseling skills, what is the very basis of successful counseling? Relationships. Relationships are the only place that change happens. The only place. We don't have change happen, true intrinsic change within a person happen because the law says so, because greater society even says so. It doesn't happen except in relationship. Bullying, we've known, is a problem for a long time, and it has become a bigger and bigger problem, and we've seen it become bigger and bigger, and we have seen greater and greater repercussions for the last 10 years or so, and nothing is changing. I think part of the reason nothing is changing is because we are not forming relationships with where change needs to happen. Change needs to happen at the local level, at the school level, at the level where implementation can actually happen. We have, as we saw, the state and federal laws that allow us to kind of push for that change, but that doesn't necessarily do a whole lot. However, if we can convince a superintendent, a school board, a principal, a school counselor, a school teacher who may be a little burned out because she's been under-supported for 10 years. If we can convince each of these people that bullying really is a problem and that we really can address it by creating an environment where children feel safe to report. Children aren't reporting because they don't feel safe to report, because they don't feel anything is going to happen, because children have reported and nothing happens. Nothing happens for a lot of different reasons. We still have a lot of people who have the mindset that bullying today is what bullying was 20 years ago, and it's not. We still have a lot of people who have the mindset, even within mental health and education, we have a lot of people who have the mindset that the best response to bullying is to stand up for yourself and fight back, or get a group of people and fight back. And
take the hit, earn the respect.
Right. And that is not the best response to bullying. And even if it was, do we want to create a society where the only response to unpleasant behavior is to fight back? That's not really what we in mental health are about. So what I call my proposal is micro-advocacy. As counselors, as teachers, as mental health professionals, part of our job is to advocate at the state level, at the national level, to make changes. But that only does so much help for our clients. Whereas if we go and we talk one-on-one with a school counselor, we talk one-on-one with the teacher that we notice kind of puts up with a little too much bullying, we talk one-on-one with some members of the school board who can kick in a little bit of extra funding or volunteer time, or can seek volunteers to ride the buses where the bullying is happening. If we can have that face-to-face time, that one-on-one time, and build the relationship, that is where change happens. Now, we can't just jump into their office and say, hey, I want to talk to you about the bullying problem. We have to build a relationship. If you don't know their name, if they don't know your face, if you don't know what they care about, if you don't know that their wife is sick with cancer, or that their son just won the state football team, then why should they listen to you? You may have the best information in the world. It may be backed up by stats, by figures, by your experience, but if you don't care about them, why should they care about you? So what I want you to do right now is I want you to take about 2 minutes, and I want you to turn to the person next to you, and I want you to identify one person, one real person, not one hypothetical person, not one title, but an actual person with an actual name. I want you to identify one person that you can go talk to. Someone that you already know would be great, that has an ability to affect change. But if you don't know someone well, think about who, okay, I can get to know this person. So go ahead, turn to the person next to you, and identify one person in your sphere of influence and write down that name.